Hey guys, this is Dr. Joe Borio with this week's Thought Flash. I wanted to talk to you today a little bit more on educating people towards better health with chiropractic care. One of the best quotes I've read, I've talked about it before, it's by Francis Bowen. He was the chair of philosophy at Harvard College, and he said that the human body is not an organism, it is an intelligence served by organs. And that is B.J. Palmer all the way, that your body is more than this. Your flesh is only serving the intelligence, that eternal part of you that existed at the time when the universe was created, and the flesh is only serving that intelligence. We have to understand that truly, as deep as that is, and that's something maybe that really only chiropractors will understand or fully own, that is what we're about. That is the true principle of what BJ and Dee Dee were actually working with. That's exactly what they talked about over and over and over. Now, when we take that, we understand that that intelligence actually resides in every cell of the body. What coordinates that intelligence is the brain and the nervous system. So the brain and the nervous system basically coordinate those impulses, those messages, to go out throughout the spine and tell the body what to do and how to function. So it's your job as a chiropractor to ensure that all those messages get where they're supposed to go throughout the body all the time. Because we use the spine regularly all the time. What happens? The spine gets shifted out of position, out of alignment, it presses on those nerves, those messages don't get where they're supposed to go, and as a result the body doesn't work as well as it's supposed to. Now we deal with a dis-ease, a dis-ease, that the body isn't symptomatic, it hasn't developed a disease yet. What it did develop, however, is the beginnings of a loss of homeostasis, that the body's now losing the ability to comprehend itself, that it's starting to lose homeostasis. And that means that if left in that state of dis-ease, loss of tone, what happens is the body will then move into a disease state. It's your job as a chiropractor to address it at dis-ease so it never develops the disease, the sickness, or illness. Okay? So not that you guys, I know I'm preaching to the choir, you know, most of the people watching these things already understand it, but it's good to talk about it again, right? So one of the things that I wanted to share with you is that I use a lot of examples on Monday night. And I'll tell you, Joe Felicia was a perfect example. I've got Joe Felicia's health talk, and this is where I got this from many years ago with Renaissance. Joe Felicia used a lot of different examples. So what better example than a telephone wire? These are pretty easy, so talk to people that work for the telephone company. They still have these. So you've got paired wire in here that you can use and say, hey, here's your spinal cord, here's your brain sending data, information, right? This nerve goes to your liver, your gallbladder, your kidney, your pancreas, and when you adjust, you're trying to open up those channels to allow the messages to go where they're supposed to. So that's a phenomenal model that I found very effective in educating people about chiropractic care. You want to work with babies and kids? You got to get a baby mount. Go right on eBay. You can buy one of these things on eBay and talk about kids. You know, this is up here all the time. So when people are in here, hey, how did my spine get like that? When did my subluxation start? When did my spine start getting sick? Well, it probably started when you were a baby, and as a result, this is why when you go through the birth process, right? And I've talked about this before, but go right on eBay, punch in obstetrical forceps, buy forceps. Show them what the birth process is like, right? You can get an obstetrical vacuum extractor. Show them what the birth process is like. You want to start working on kids, show them what it is like, obviously, to go through the birth process. This is another model. I got that on eBay, right? And this is teeth. So I equate what we do. We do more of a CBP, more of a structural adjustment in the office. So our goal is to make the spine straighter, healthier, have more normal curves. So what do we use? We use models that they can anchor to. They can relate something to this, right? So they can say, hey, this is teeth. Well, who do you see when your teeth are crooked? An orthodontist. What do? They straighten your teeth. How do they do that? Through braces. Well, how do they work? Well, you go in for a chiropractic adjustment. You get adjusted every couple of weeks or month. They tighten them up, changes the shape of the brace, which puts more force on the tooth, which remodels the ligament, right? So the same is true with your spine. When your spine's crooked or out of alignment, right? What are you going to do? You're going to readjust the spine to allow the spine to come back into alignment. And I tell people, you know, it's the elephant in the room, money and frequency of care. Hey, why do I need to come 3 times a week? Because I ask them, what's going to happen? Your spine's been out of alignment 30 years. I adjust it. Is it going to stay there, or is it going to go back to the way it was? Well, it's going to go back to the way it was. So what do we need to do? We need to keep adjusting it very specifically, what Bob Schiffman teach me, right? Very specific scientific chiropractic adjustment. Specific scientific chiropractic adjustment. Get used to speaking in those terms. Listen, I'm not laying you down, whipping it and cracking it and ringing it. I'm doing a very specific adjustment, at least I hope you are, to a segment of the spine to allow that segment to function better. And when you do that adjustment, tell the patient, listen, Bob, that adjusted really well, and that area goes to the pancreas, the liver, the kidney, and the adrenal glands. And that's going to allow the body to function better and work better, and that's going to allow better flow of messages through the body. Start getting into those conversations, and you need to do that regularly. Why? Because we're in an open setting, so not only are they going to hear it, but they're going to hear it, and the people sitting out there are going to hear it, and you're going to be talking like that all day long, all month long, all year long, all career long. You're going to be talking like that all the time. So when a patient comes in, think of this as a pool. They're going to get dipped. You're submerged in the philosophy and principle and the science of chiropractic. They're going to come in, and they're going to get dipped in it. Every time they come in, you're dipping, you're talking chiropractic. And that doesn't mean back pain, that means neurology. Remember, the benefit of care is afferent and efferent. The benefit of getting an adjustment, it means that the brain can talk better to the body and the body can talk better to the brain. Speak in those terms. Understand that you shouldn't use vocabulary or examples or explanations that exceed really 5th or 6th grade. That's the level of understanding that most people have when it comes to the anatomy and physiology of your body. So use examples that they're going to understand. What's another great example? Here's a garden hose. I cut a section of garden hose. Bob, listen, if this is your nerve, here's your liver on this end, and here's your brain, and I step on the hose, right? What's going to happen to the flow of information that goes to the liver? Right? What's going to happen to the flow of it? Well, it's not going to get there. So what's going to happen to the liver? Right, so what do we need to do? You want me to put pills on it, inject it? Is that what you want me to do? No, what do you want me to do? I want you to adjust it to relieve the pressure, which means what's going to happen to the flow of information? It's going to go better to the liver or to the kidney. And then what's that mean? What does that mean to the health of the organ? Well, it's going to be healthier. It's not rocket science. How long do you need to care for the spine? For the rest of your life. There you go. That's your explanation of chiropractic care, right? How true is it, right? And then we just did a webinar with our clients. Excuse me. We did a webinar with our clients yesterday, and I'm going to do a talk tonight over at the New York State Chiropractic Association and the New York State Council. Unfortunately, in New York State, we still have 2 associations. Hopefully that'll end soon, but they're starting to work together, thank God. But the bottom line is I'm going to be doing a talk tonight on science, the science of the vertebral subluxation, meaning that the misalignment of the spine and how it affects the flow and function of the body and how it affects the flow and function of information and data that goes to all the organs and into the different body parts. And the fact that vertebrates do have a reward system, an opiate reward system in the brain that affects it. We know that if I adjust dysfunctional joints in the neck that aren't even symptomatic, these people aren't coming in with neck pain, dysfunctional joints in the neck will result in a loss of speed. There's an increased degree of latency between afferent and efferent flow from the brain to the body tissue. That has been changed with evoked potentials. They're able to measure that, brainstem evoked potentials. They can measure that. It's out of Carrick's work. We're also seeing studies that show ear infections, asthma, Crohn's, and ulcerative colitis all have been significantly reduced, cured, corrected by restoring nerve function. When people say, well, how does crack in your back affect it? You got to stop and say, Bob, it's not the crack, it's not the pop. It's the fact that, what am I moving? Ask them questions. Moving the vertebrae. Why am I moving the vertebrae? What's it pressing? What's it pinching on nerves? Exactly. Do you realize you got to pinch on a nerve by up to 50 to 60% before the nerve even becomes symptomatic? You could be pre-spondylitic, meaning the nerve could be hypersensitive, which greatly affects the nerve's ability to inhibit, which causes loss of inhibition of sympathetics, makes you sick. But they're not even symptomatic at that point. That's the loss of tone. That's dis-ease. That's a loss of normal function of the nerve. However, the nerve itself has not become symptomatic yet. Those are the terms in which you need to speak to people. Listen, we're running out of time, guys. It was always great. Thanks for bringing me in your home. We've got a seminar coming up in Las Vegas, 21st, 22nd of January. Please, I really insist, anyone out there that loves what we're doing or our Thot Flashes, wants to practice principal chiropractic, give us a call. I'm going to be at CalJam second week of February. So go to caljam.org, sign up for that. Listen, guys, this has been Dr. Joe Borio. May your innate flow from above down, inside out. Have a great week.
My best friend gave me the best.